People are frustrated and angry because there seems to be a disconnect between the government's decisions and the science. This boiled over with the incomprehensible measures announced last Friday. Speaker, if we have any hope of getting ahead of this virus and saving people's lives, people need to be able to trust their government. People need to know that the government is listening to, understands, and is acting on the science. So, Speaker, I'm asking through you to the Deputy Premier, will you commit today to publicly release all recommendations from the Science Advisory Table, not just modelling data, but recommendations, before the government announces any new or changes to public health measures?
Minister of Health.
Thank you, Speaker. And I thank the member for the question. What I can advise is this information is already available. We have regular modelling that is presented to us by the Science Advisory Table. Dr. Brown and others come forward publicly to release this information as soon as it's available, to indicate to the members of the public, to the other members of this House, exactly what they are seeing and what the recommendations are. This is available. With this information is registered on the website. Dr. Brown is available to answer any questions. Members of the Science Advisory Table have already come out with their own views about issues as well. There's no indication, there's no gag order they have to sign. They are free to talk about their recommendations, and they are already doing that.
Supplementary.
Speaker, I realize this is called question period and not answer period, but right now I think the people of Ontario need an answer. On February 11th, the chair of the Science Advisory Table said we were headed to a disaster if the government lifted restrictions. We're facing that disaster today. Last Friday, when we needed people to take public health measures seriously, people were just dumbfounded by what was announced. And they were trying to say, is the government really following the Science Table's advice? And so that's why I'm asking, Speaker. I'm asking because we need everybody in this province right now at this critical moment to work together. And that requires trust and confidence. And so the people of Ontario need to know, through you, Speaker, to the Deputy Premier, will you release the modelling data we know is released, but will you please release the Science Table's recommendations so people know that they have confidence that the government is following those recommendations?
Minister of Health.
Thank you, Speaker. This information is already available. The Science Advisory Table, as you know, issued a document several days ago that contained their recommendations. I'm not sure what else the member would like to have released, but that is what was released. We have been following the recommendations. We have been told that we need to limit mobility because that is how this is being transmitted. We are doing that with our stay-at-home order and with the other orders that we've brought forward. We have been told that we need to build our hospital capacity. We are doing exactly that, including with our intensive care beds. We have been told that we need to use the system as a whole. We are doing that with the order of transferring patients from one location to the other and using the entire system as a whole. The Science Advisory Table is providing recommendations that we have been following. Do we follow every single thing that every single medical expert advises us to do? That is our responsibility as government to make some of those decisions. But we are following the advice that we are receiving for Dr. Williams, the Chief Medical Officer of Health, the Public Health Preventive Measures Table, the Science Advisory Table.
Thank you. Thank you very much.